Hi, this is Dr. David Greene, CEO of the U.S. Pain Network, where we connect those in pain with pain providers nationwide. Today the topic is a difficult one for patients called coccydynia. Now, coccydynia is essentially tailbone pain, and it can be pretty disabling for those who are suffering from it. Now, it can occur for any number of reasons. One of the most common, though, and I'll show you on the spine model here, can be from a previous fracture of the tailbone that just didn't heal properly. Okay? So you have the lumbar spine coming down, then it meets up with the sacrum here, and at the very bottom you have the coccyx, and that's a triangle-shaped bone. And you don't see it here, but there is a fibrocartilage connection between the sacrum and the coccyx. All right? So if someone falls on their buttock area and fractures the coccyx, it may heal in a weird position, kind of an angle that hurts when people sit on it or shift around. So that's one of the main reasons. Another one might be inflammation of the soft tissues around the tailbone, and this could be also from a fall, and that might be pain that waxes and wanes for years. It could also be from a growth in the rectal or pelvic area that's either cancerous or benign, those types of issues. So the physician who is working up the process will most likely, if it's chronic, obtain x-rays and an MRI and do a thorough physical exam to see where the tenderness is, if there's any growths that they can feel. Okay? So what are the best treatments that are available? Well, like I said, it can be a very difficult diagnosis to treat, but first and foremost, just the simple things. Over-the-counter non-steroidal anti-inflammatories, Tylenol, those can help substantially as a baseline. And for those periods where it waxes and wanes, when it's exacerbated, short-term narcotics can be beneficial. Not chronic narcotics, because the risks start to outweigh the benefits. All right? Treatments that can be done on top of that, there is some physical therapy exercises, such as for the pelvic floor and things like that, to help stretch and strengthen the area. Massage can be very beneficial, as well as electrical stimulation, ice, heat. There has been some research looking at chiropractic manipulation of the coccyx. Now that's fairly invasive and can be fairly uncomfortable, but there have been some research studies looking at how effective it is, and the consensus is that there can be some mildly beneficial effects short term. Okay? There's a study done back in '06 looking at that specifically. One of the best treatments out there for tailbone pain that pain management doctors around the country will do is called a ganglion impar block, I-M-P-A-R. Now essentially what's happening is, this is the coccyx, and in front of it is a plexus of nerves, a collection of nerves that provide sensation to a broad area around the tailbone, the rectum, some of the pelvis, the vaginal area, things like that. And basically, if a pain doctor goes in and deadens this area or numbs it up, it can provide pain relief around the tailbone for months at a time. All right? If that works and then wears off, it can be repeated, or a pain doctor can do what's called a radiofrequency ablation, which is pulsing thermal heat through this plexus of nerves, and that can provide pain relief for 6 months. Latest study that I saw showed 60% benefit for 6 months. So very good results for a very difficult problem. Okay? So you have the ganglion impar block, you have physical therapy, chiropractic treatment, medication management, and a TENS unit can also help be very beneficial, and that can just be placed pads over this area, 2 hours on, 2 hours off, things like that. Okay? So check out our website at uspainnetwork.com. There's an extensive amount of education on the site, a lot of videos, and best of all, a lot of pain clinic listings that are hopefully close to you to help you get treatment today. I'm Dr. David Greene with the U.S. Pain Network. Your pain stops here.